Welcome to Living Fuel TV. I'm Casey Craichy. Today I have special guest Dr. Patrick Purdue. Dr. Purdue, very excited to have you today.
Thank you.
Dr. Purdue and I often have these long discussions about things that can change the world, and there's never been a camera in our discussions.
True
so
enough.
now we have the opportunity. First I want to talk about, you're a doctor of Oriental Medicine.
Yes.
And you're a naturopathic doctor.
Mm-hmm.
Now talk to us about, because most people out here are thinking, Doctor of Oriental Medicine, he's really good with needles. And you are.
Yeah.
But tell us a little bit more about
Sure.
Oriental Medicine.
Traditional Chinese medicine is easily 3,000 years old. That's roughly when the time period was that the first textbook was written, which is called the Yellow Emperor's Internal Classic Medicine. And since that time, over 80,000 textbooks have been written just in Chinese medicine. When you review the literature, what you see very clearly is acupuncture is less than 10% of the medicine. Well over 90% is internal medicine, which has always been my favorite in my specialty. Acupuncture more or less belongs in the Orthopedic Division of Chinese medicine. So in other words, it's excellent for musculoskeletal aches and pains. Even though it sounds maybe counterintuitive, a lot of people tell you when a bunch of needles are stuck in them, they get enormously relaxed.
Yeah, it doesn't quite seem to work that way, but it's really true.
It is true.
So that's very interesting. So you're saying that the needle part is like a specialty in allopathic medicine, being orthopedic medicine.
Exactly.
That's very
true.
interesting.
Mm-hmm.
Very interesting.
Yeah, they call the specialty studies in Chinese Ke. So NAKE is internal specialty or internal medicine, and that's what I do. And within that large umbrella of internal medicine, you have the subspecialties: women's health issues, cardiovascular issues, gastrointestinal issues. And I actually did extensive women's health issue studies right before I graduated and after I graduated. It was a continuing program. So that started off as my main specialty. And since then I've branched off into GI issues and cardiovascular and so forth.
Very interesting. In the changing medical environment we have right now with the new healthcare, and I really have a hard time with the word healthcare when you're talking about disease management versus healthcare.
Disease care.
Disease care, yes. And so I'm a big fan of naturopathic medicine, Oriental medicine, and chiropractic, and so on. They quote alternatives, but interestingly, allopathic medicine tends to call it alternative medicine until it's proven that it works, and then it's allopathic medicine. You know how that works.
That's exactly true.
But the truth is that physiological medicine is what you try to do. You try to put things back in their normal course and take away blockages, and let the body do what it's designed to do. Right?
That's true. And actually, in 1994, Dr. David Eisenstadt at Harvard Med School published a study in Journal of the American Medical Association that found well over 50% of the American population is using some form of alternative medicine. So my opinion about that is, well, that doesn't make it alternative, does it?
Right, it's not alternative, exactly.
Yeah.
Well, we're going to go into some things about conventional medicine that people need to know about, in the studies in another segment here. But right now, I really want to stay on what you do and how someone can benefit from that. They only used to going to their family doctor and getting a prescription, because if you go, it's like a transaction. You go to the doctor and you get a prescription. So how is it that you practice differently than that?
Well, under Florida law, I'm considered a primary care provider, and we literally, what that means is anything that walks in the door I can address. So, we get flu, cold, urinary tract infections, upper respiratory infections, all those common things that any medical practice gets. What I do to treat it is, rather than slapping an antibiotic onto someone, not to say that there isn't a time and a place for that, but more often, most of the time, in most cases, I can resolve bacterial infections, viral infections with herbal medicine, and not have to refer the patient out for an antibiotic.
Exactly. Well, the pharmacological side effects are crazy,
yes,
for sure, and the body's really designed to do all the things you're talking about if you can just support it along, obviously. Now, I want to mention also, you've developed a program that can help a Doctor of Oriental Medicine become more like a family practitioner. Mm-hmm. And this also works for chiropractors and other types of practitioners. Tell us about that.
Well, to say, basically, I embrace the idea, according to our state law, that we can do pretty much anything in practice. We're considered primary care providers. That means we have to know a lot of stuff. Well, in our schooling, we're trained a lot and very thoroughly in traditional Chinese medicine. We get a lot of schooling in Western biophysical medicine, but we're not trained to be an MD pharmaceutical prescribing style doctor. But that doesn't mean that we can't handle all those things that doctors of that type will handle. So I saw a lack in our education, an area where continuing education could be provided that would bring along someone who wants to have that kind of training up to a level where they can perform as a local family, neighborhood, primary care doc. And so that's what the program is all about. And so it gets into a lot of physical examination techniques and so forth.
Well, that's very exciting. So how does an average person, though, integrate what you do when they're really accustomed to doing it the way their insurance has directed them, so to speak? How do they integrate? When do they decide they come to you instead of their current primary care?
I do a lot of education with my patients. When a new patient comes in, typically they're coming in to handle an issue. It may be physical pain. It may be some internal medicine complication where they've tried all the conventional drug therapy, nothing's worked, they're getting worse. And one of their friends or neighbors mentioned my name, and they happen to come walking in the door just to see what I'm up to. And so I educate them right from the get-go and inform them, look, I want you to let me know about anything that happens to you. Your kid wakes up in the middle of the night, screaming from an ear infection, call the office. And so I just inform them that, use us as your go-to place for any kind of healthcare issues.
Okay. Well, this is the one thing I like about you is that you're an avid researcher and that you use the clinical evidence from the major medical journals to guide your practice. Mm-hmm. And to me, one person once said that if a conventional medicine doc would come out of school and he would be absolutely committed to reading a couple abstracts and a full study every day after he graduates, he's going to be the best doctor ever. That in 12 months he'll be 400 years behind in the research.
True enough.
So you really have to get away from the conventional, looking just at the conventional approaches and standards of practice, and start looking at the same journals to see what they deliver to such extraordinary evidence out there about helping the body overcome things which are seemingly chronic. That will just continue in conventional medicine. But we're going to get into some exciting discussions here in a few more segments. So, Dr. Purdue, thank you so much
for
coming today, and I look forward to the future segments.
Thank you.
All right. I hope you enjoyed it. God bless you, and have a great day.